Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast, brought to you by RipsyTech. I'm RipsyTech Product Manager Parker Anderson, as always, joined by founder and CEO of RipsyTech, Tom Tarshis. Hey, Tom.
Hey, Parker. How's your adrenaline level doing?
I think it's doing pretty good. A lot going on in my world today.
Yeah, Parker has become a new homeowner, signing very big loan documents today.
But it's just this morning.
An exciting time, and
wired a lot of money out of my bank account. Just gone.
Yeah, but that's you're on path to the right American dream.
Right.
The past.
Well, yeah, in the past year, got married, had a child, bought a house. I think I'm on my way to retirement.
And you started saving more for retirement too, also, right?
Yes, that is true. I did. And for any listeners who have caught me slyly making comments over the last few weeks, I also did, my Nintendo Switch 2 did show up very recently. I think by the time this episode comes out, actually no, this should be coming out pretty soon. Yes, that they it was delivered yesterday. So
very good. And as you know, as we're talking about money, it's a good segue into what we're going to cover today. But I'll let you introduce the topic, Parker.
Yeah, so this week we wanted to talk about billing for providers, namely what the difference is between the different forms of billing or types of billing. Namely, we know that there's complexity-based billing, time-based billing, procedure-based billing. That's three different things that I mentioned there. So I was hoping you could kind of clear the air a little bit. What's the difference between those things?
Yeah, and I think in some maybe very early podcasts we've talked about this topic a little bit, but I think, Parker, as we get more and more customers and people starting their clinics and practices, this continues to be a topic that's confusing and sometimes difficult to think about, and I think that's why both we've recorded a little very direct video with a template to share with Ripsy clients, and then also wanted to have a conversation about this so that we can really talk about what is the right way for yourself and for your patients to do billing as a mental health clinician. I will say this episode is maybe a little more relevant to people who can prescribe medications. However, that's not completely true, because we're really going to be talking about, a limitation with setting an hourly rate or just billing on time. Even as a therapist or psychologist, you're potentially missing out on these add-on interactive codes if you just try to do a model for billing by time. And then for prescribers, there are ways to bill what's called the E&M, the evaluation and management piece of a visit, based on how complex the cases that you're treating, and as well as the potential to add on this complexity code if you're speaking another language or working with a specialized item, which we do a lot with kids. But there is an alternate where you can just bill by time with these codes, and that is just not the right way to do it, in my opinion.
I do want to quickly mention that how you mentioned that this episode might be more relevant towards like a prescriber, physician, but there is one question that I have for you that is therapist billing related. So if you're a therapist listening to this episode right now, check out the timestamps, because we always leave the timestamps to the questions that we ask in the description. So look through there. If you want to just kind of skip ahead to see what's extra relevant for you, feel free. But also, hopefully, just the general education of the episode is useful in and of itself, and you don't need to skip ahead, but just wanted to air that out there. So anyway, continue with what you were saying.
Gotcha. Yeah, very good. So if we'll, let's talk about what are called these E&M codes. So there's, 4 different codes when you're doing a new intake. They're 99202 through 99205. And then there's 4 of these codes for follow-ups, 99212 through 99215. The 202 and 212 codes are really almost never billed on complexity level. And each of those codes, when you look them up, it will say like moderate complexity, and then they each have a time attached to them as well.
Right.
So, for example, a 99215 is if you spend more than 40 minutes with your patient, you can just bill this code and say in your note, I spent 41 minutes with them. And boom, if you're audited, yeah, the insurance company can't deny that that's how you built that session. If we jump back historically, these codes were really not designed for mental health clinicians. They were designed for primary care physicians or other doctors that often would spend a lot of time counseling their patients. And there wasn't a great way to capture just the time spent in counseling services. So these were, if you're a primary care physician and you spend 20 minutes talking to your patient about how to manage their blood pressure, oftentimes billing that by this complexity level would shortchange the primary care clinicians, because you could spend 5 minutes with someone whose hypertension is well controlled, or you could spend 35 minutes trying to convince someone to take salt out of their diet, and you weren't getting any difference in compensation for that time. And that's kind of the history of these codes. In 2017, so in psychiatry, there used to be completely different codes on how we used to bill, but in catching up with the times in 2017, it shifted so that physician assistants, nurse practitioners, psychiatrists could actually start using these E&M codes, as well as having these psychotherapy codes that we could add on for the time spent. And so when that happened, it was actually great news for mental health clinicians who could prescribe, because it validated that we have complex patients as well, and we should be able to bill by complexity, and that we need to recognize our specialized training to be able to deliver therapy services. And so at the very basic level, everything was designed to allow mental health clinicians to bill by complexity and then use the psychotherapy add-on for that time we spent in therapy with the patient. Anyway, I'll pause there, but that's sort of the evolution of the bill codes.
Okay, so you're saying that historically speaking, psychiatrists did have to bill by time before that?
It wasn't even billing by time. It's sort of, there was a distinct separate set of codes for medication services. In fact, there was one code you used for medication services, and then there was just billing the psychotherapy by time.
Gotcha. Okay, go ahead.
Oh, yeah. So if you were doing any type of medication service, you just got to bill this medication code. There was no sort of recognition of the complexity of the case or how difficult someone's symptoms were managing the patient. So it wasn't a great system.
Okay, so then, yeah, I guess my follow-up question would be, because we advise a lot of our new customers about, because most of them are starting a business for the first time, so they come to us with looking for advice, and so not a lot of them, but like there's always some every once in a while who will approach us saying that they want to bill completely based on time. And I know you typically suggest against this. So, I mean, the complexity codes as you describe them make a lot of sense, but why exactly do you think the billing by complexity versus time in this case is just the better option? Is it because it's easier to document? Is there more to it? Is it more advantageous for your billing? I mean, you mentioned like the insurance auditing example. Yeah, I guess, speak further to that.
Yeah, and I think, in this industry where 60% or so of all clinicians, are cash based because they don't want to deal with insurance headaches, you certainly the logical way to do it would be to bill based on time. So if no one was a cash based business, I think people would conform more to the type of billing that maximizes revenue for you as a provider and helps with your patient's reimbursement. But that being said, because so many people are just in private practice and charge by time, it's logical. Unfortunately, our healthcare system is not really logical, but billing by time is logical, and so
I mean, that's
that's
how practically every other industry is going to be charging you.
right. So fair enough, and we understand that piece. And then it's true when people are starting a practice, you can sort of look around and say, oh, people in the Atlanta metropolitan area, a child psychiatrist tends to charge this much per hour. And that's just, you can look at people's rates or ask people what they charge. That's very logical. And if you're not going to take insurance, you can set up a billing structure where you can bill by time. Ultimately, you do need to provide a super bill to all of your clients with listed CPT codes that then that patient can submit to the insurance company to get reimbursement. And what happens is, for example, if as a prescriber you decide, I'm just going to use these E&M codes based on time, and hey, if I'm charging $300 an hour, okay, for a 53 plus minute session, it's 300. For a 45 minute, it's 225. So you can set up a logical system, but then when you give that super bill, you'll get your $300 an hour because you're a cash practice. But when you give that super bill to your patient and it just has the one E&M code they submit to their insurance company, they're going to, in general, right, the insurance company isn't going to give 50%. If the out-of-network benefit is 50%, you're not getting $150 back. The insurance company is going to say, oh, we only think people should be charging $150 an hour. So we're only giving you 50% of what we think is fair. So you're getting $75. Whereas if you actually bill by complexity for the E&M code and then put a psychotherapy add-on, then there's two CPT codes that your patient is submitting to the insurance company. They are going to get more money back because the insurance company is going to have to give some reimbursement for each of those. And even if they still don't really give a fair amount, it is still potentially getting your patients double what they would get if you're just putting one CPT code on the super bill.
Okay, wow. That's huge. That makes a lot of sense. So why do you think, what do you think the reason is that, is it just because it seems like the logical thing to do to charge by time? And why do you think it's like just a knowledge gap, or is it kind of a system level problem? They don't teach you this in school type of thing? Like, why do you think more prescribers aren't taught to code based on complexity, even if they're going to be, a cash practice?
Yeah, it's definitely what you alluded to, Parker, and I think we've mentioned that you just don't get training on billing practices, on finance, on starting a business or anything. And in general, when you're in your school, your mentors are not people in private practice. They're people in academic settings who sort of get a paycheck and don't have to spend that much time learning even the right bill codes or how to bill often. So it is a huge knowledge gap. I would say, there are, so we have this sort of ethical issue if you're a cash practice about getting your patients more money. On the prescriber side, you are lowering your risk. Well, for a cash practice, you're not really lowering your risk for anything because no one's going to audit your records to justify what you put on your super bill.
Right.
You're keeping it a little maybe less confusing to not have to explain the E&M codes to your patients, or explaining why, hey, um, how come well, there is a strategy to actually, and we're in our training video we talk about this, that if you're really set on wanting to bill by time, there is a way where you can have a flat rate you want to earn per hour and still make that work and to have two CPT codes. And it's essentially by saying we're going to bill the same dollar amount no matter what complexity code is on the we bill for. So whether it's an easy complexity 99213 or the most advanced complexity 99215, you're just always going to charge $100.
That makes sense.
And then you can do the psychotherapy add-on and you make that number vary based on the time. And that's how you could set, okay, for 30 minutes, it's this, for 45, it's this, and for 60, it's this. That is really not the preferred way to do it to maximize your revenue, though, because despite the fact that this is very confusing, it is a system that's set up that if you're dealing with a very complex case, you deserve more reimbursement. And that's what happens where insurance companies have accepted that. That's how Medicare works. In addition, we have this other interactive complexity add-on code, which when you decide to only bill by time, even if you set up still bill by E&M and psychotherapy add-on, if you have to set that interactive complexity code to 0 if you want to just keep your rates always the same. So if you're doing a session in another language, if you're using specialized toys with your kids, if patients were yelling at you or someone was really anxious in session, you're giving up that revenue that you deserve from that session being a little bit more difficult.
Okay, so I want to skip ahead a little bit to the question that I mentioned at the top of the episode about billing for therapists, because when we were discussing the idea for this episode, you mentioned that billing by time as it pertains to interactive complexity can be the right fit for a therapist billing for their visit. So could you explain a little bit more about that?
Yeah, and so it's if you're a therapist or a psychologist, it's a little more straightforward with respect to the CPT code you put down for a visit is just actually time-based. So there are time-based codes for 30-minute, 45-minute, and 60-minute sessions. However, there are the CPT codes, and the government and Medicare and insurance companies still recognize this interactive complexity code for non-prescribers. And so it's the same thing we just mentioned. Are you doing a session in another language? Was there intense emotions in the session? Were there specialized items used in the session? That is, in any therapy session, you're eligible to do this add-on code. So maybe you saw a patient for 45 minutes, but you're doing the session in Spanish. You should be able to charge your $200 for 45 minutes and then an extra, whatever you feel is fair. There's ways to look up what average reimbursement is, but I think the intent of this code was actually to help people that work with kids have a little extra billing for doing that type of work. But that's reasonable to be an extra $25 or $50 if you have that type of session. If you're just saying to your patients, here's my hourly rates, you can never bill that code. So the ask is for the clinicians, what you have to deal with is, hey, here's my rates, but by the way, if any of this happens in the session, it's an extra $25. Like as a non-prescriber, you need to communicate. There is this 90785 complexity code. it will get you more reimbursement back from your super bill if this is on the if I charge this code plus the therapy code, but you are going to have to pay me more for those services, which is reasonable, but it can still be if this is confusing for the clinicians, it's certainly confusing for the patients as well. And so you have to make that extra effort to explain it within your practice.
So that does all make sense to me, and I'm not sure if we said it explicitly out loud, but this is really advice that's geared towards people who have a cash practice versus, because like if you're going to be billing based on complexity if you are taking in network contracts with your insurance companies regardless. Correct?
Well,
not even.
Yeah. So unfortunately, Parker, even people with the insurance contracts often will maybe be billing just by E&M codes by time and giving up the psychotherapy add-on. And this is another education piece where if someone says, well, I did a 25-minute follow-up, but it's a medication session, so I'm not allowed to bill psychotherapy add-on. Like that is not true. Like if you're spending 25 minutes with the patient, that is not all about the medication. You are talking about other things in life. How are things going? What happened here? You're giving suggestions. You're listening to your patient. Like theoretically, if you spend 10 minutes only, right? If you go see your primary care doctor for a hurt knee and they spend 6 minutes with you, they're billing E&M on complexity only. And there is, if your session with your patients is less than 16 minutes, you don't qualify for a psychotherapy add-on. And that is where you should be, traditionally E&M by complexity. But there are very few people in this field who are just spending 10 or less minutes talking to someone about their antidepressant medication, and that's it. Like that would be any side effects, any problems. Okay, this is your dose. Here's our plan. We might increase the dose. How's sleep and appetite? Okay, see you in 2 weeks. Like that's bad care, and very few people do that. You're always checking in about, we know life for mental health is affected by friends, family, social, and we're trained to ask about those things. That is supportive psychotherapy, and that warrants the add-on code. And that is how it should be billed, but not people who take insurance. It's got to be a very high number who actually don't bill insurance properly. And then that increases frustration with low payments and other things with insurances. And that people might get afraid about, I'm going to be audited, et cetera. And that's why, in Ripsy, we build in all these tools to help people know you're, billing the right code and help protect you from some of those, from that fear piece. But it happens in long answer to, but yeah, it still happens with insurance-based billing.
Okay, so yeah, we've talked a lot about this, and I feel like you've given kind of examples as you've gone, but can you give any kind of explicit example, like walk us through an example where a prescriber could have billed more appropriately by complexity instead of time?
Yeah, great question. And we know sometimes, I think we have our video with the shared screen that gives very good numbers and actual examples. So we'll see how clear we can be with for our sort of audio only. And I will say, for cash practices especially, there is a Disclosures Act on how much patients will be paying. And so you do need to inform your patients of how much they're going to be paying for sessions. You don't need to be exact, though. You need to sort of say what the highest amount is. And so you'll even see on our clinic website, we sort of list a range. So we say for a 30-minute visit, it's going to be, these aren't the numbers, but just for example, you might be paying $200 to $350 based on these factors. And we try to explain it. But every cash practice is obligated to disclose that. We actually accept insurance, so we don't have to, but we still disclose it. But yeah, so for a specific example, let's go ahead and say you just spent 44 minutes in a session with a kid, and you're talking about a prescription for their SSRI medication for their anxiety, and as well, you spent a lot of time talking about a big fight that they had with the parents the last week. And then you actually bring in a parent at the end of the session. And within the session, the parent and the kid start yelling at each other. Someone starts crying, and it's an intense session. So what happens often is someone, okay, well, it was 43 minutes. I'm going to bill a 99215, which is, 40 minutes, and I'm just going to build that one code by time. And the 99215, for a prescriber in California, might pay $250 as a typical insurance reimbursement amount. So that would be billing E&M codes by time, sort of the wrong approach. You're going to get $250 from the insurance company, whereas in reality, what you were able to bill would have been, okay, if it's just an SSRI and maybe the prescriber piece wasn't that complex, but if the kid has anxiety, depression, and a couple of different problems, you're almost certainly meeting criteria for a 99214. So that may pay $200 instead of the $250 for a 99215. But then you've got the psychotherapy add-on code for 38 to 53 minutes, which that could be another $150. So you're up to $350. And then you've got the interactive complexity code because people were yelling at each other and it was an intense session. And that gets you another $25 from insurance. So instead of getting $250 just for billing the 99215, you're up to $375 for billing the 99214 based on complexity, plus the psychotherapy add-on and interactive complexity add-on. So it is always a big difference in reimbursement through insurance. And that's, that is also the way that you should kind of try to set up your private practice and explain it as best you can to your patients.
Wow. Okay. I mean, that makes a whole lot of sense. So, so to the person who is listening right now, mid episode, they hear that story and they're having this realization of, oh no, maybe I've been doing this wrong. Maybe I need to do this a little bit differently. Where should they start?
Yeah, and it's a good. There is one piece for people who are sort of doing a solo cash private practice, and that's just what that's going to be your role as a mental health clinician. A lot of things are less urgent, and maybe to help your patients who are submitting their super bills, maybe you want to modify how you do your charges, keep so that people get 2 CPT codes to submit for reimbursement. But if you want to just leave your hourly rate the same or however you've been doing it, sort of, that's fine. However, if you have any, if you want to do any better budget projections, if you want to tie your yearly rate increases for your rates to what the government does through Medicare, or if you ever have any plans of having a staff or creating a group or expanding in the future, the advice would be, okay, right, it's June right now, okay, give yourself a little bit of time, and right, nothing's urgent, but figure out how you're gonna educate yourself on these billing practices, figure out what the new charges are going to be based on the different CPT codes to still sort of match what you need for your budget, for your company and personal life. And then pick a date. Maybe it's actually January 1st, 2026, or picking a date 3 or 4 months out. It's nice to give patients 90 days notice of anything changing with billing or other practices in your clinic, and then start to put together sort of a thoughtful explanation of, hey, everyone, California excellent mental health providers practice is we're going to be changing how we do our billing. Here's the reasons why we're doing this, and really focus on hey, this is going to help you when you have that super bill get more money back from your insurance company. So right, start with the positive. We're making a change to help our patients. We really like the ethics of doing this. It is going to make some things a little more complicated, or you're going to have to, it may actually increase the cost of some of your sessions, but it will increase your reimbursement, potentially by more than that if people haven't been billing by complexity in the past. Just take your time to make sure you understand things carefully yourself to the point where you can really explain it as clear as possible to your patients. And yeah, that's something that, of course, we help our current clients with and are happy to give advice on as well.
Sounds like another video that RipsyTech could give to their customers to give to their patients. The patient-directed video. I know we've talked. We were doing this podcast, and we've kind of got our own separate how-to for our customers. But maybe here, customers, give this to your patients next time you're making this move and they have questions. Kind of a video. Just throwing it out there.
I like it. Thanks for making more work for me, Parker. No, it's a great idea. Yeah, it's a great idea.
Little quid pro quo there. Okay, well, we're coming close to the end of the episode. Do you have any mental health business moments for this week?
Let's see. Oh, well, it's been a while, but I think we had talked about like looking for more office space. And there are some updates on that happened this week. So
good timing.
Our executive director went and checked out a couple other office spaces. It's this situation where, planning how many offices to get when you're about to expand. So, okay, we need one more office now. How many will you need in 6 months? It's a difficult balance to figure out. But, it is this other piece where sometimes if you're patient, other options appear. And whereas a couple months, we really like our current space, but there's not openings there for more offices. And we reached out a couple months ago to ask about space and like, oh, there's nothing available. And then, the other day, my partner and I saw someone being shown office space in our building. And in addition to quote, my lease for RipsyTech actually having a right of first opportunity clause in it, which means if another space becomes available, we get first dibs. They didn't tell us about that. So, but because we noticed people walking around, we were able to sort of contact the landlords and see the space, and we were able to grab it.
Oh, wow.
And so, the current setup is sort of a larger building with a bunch of mainly mental health professional offices. It has a shared waiting room. So it's probably not great after you get to a certain size, but it's going to meet this immediate need of giving us 3 therapy offices in a great location that people like. And it is going to be the more affordable option than trying to figure out, do we get a place with 5 offices or 6? And this is a landlord and group that we know who are reasonable people, although that maybe they're not fully on top of knowing which tenants are supposed to be notified of openings first. But anyway, that's the...
Make sure you look out for the first dibs clause in your contract, is what I'm hearing. Okay, cool. That's well, congratulations. You've secured your own space. I've secured my own space. It's a good time to be getting space, I guess.
Very true. Very true.
Awesome. Well, this has been a great episode. I think we'll go ahead and wrap things up here. So thank you for tuning in to this week's episode of the podcast, Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, we would love a rating or review wherever you're listening. And if you'd like to get in touch, send us an email at sitandstay@ripsytech.com. All right, Tom. It was great. I'll talk to you next time.
Thank you, Parker. See you soon.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.